Hi, I'm Dr. Heather Rice from Wellspring Chiropractic Lifestyle Center. Today we're talking about TMJ problems and what are the conventional things that people are doing if they struggle with this. Well, the first approach is usually they just try to live around it. Maybe this is going to go away. And when it doesn't, it's going to be a problem. But living around it, what does that look like? Oh, well, I can't open my mouth as wide, so I can't do those big sandwiches that I used to love to eat, right? Or I can't even yawn the way I want to. So it really can affect your quality of life. Other people are staying away from the chewy foods and just sticking with the soft foods, soft, bland foods. That'll affect your quality of life too. Well, we also know that people will start to take over-the-counter medications as a very common approach of just trying to deal with the pain in the jaw. And that means that they may start to use them too much, and that can be a problem. The studies are showing that there's actually a lifetime limit to how much NSAID use, we call it, non-steroidal anti-inflammatory drugs, things like ibuprofen, Motrin, that kind of thing, Advil. And when you start to use those on a regular basis, it actually adds up. And the lifetime limit they talk about is if you have 1,000 of those pills in a lifetime, you actually increase your risk of kidney failure by 4 times. And if you have 5,000 in a lifetime, you increase it by 800%. So it's a good short-term strategy maybe, but not a good long-term strategy. We also find that people will then go to even more extremes where they may go to prescription medications. Because anxiety and stress is often associated with TMJ problems, you'll see people that are taking anti-anxiety medications, antidepressant medications, anti-seizure medications, and even opioids. And we know how much of a problem the whole opioid addiction is. So, boy, that's starting with one problem and leading to bigger problems. And so that's, again, not going to be the best approach because it's not actually addressing what the cause of the problem is. And we also know that people will use things like Botox injections. That's injecting a toxin into your muscles and your jaw in order to try and actually disengage the muscles. It's trying to relax the muscles, but it's actually poisoning that is paralyzing the muscles and stopping them from working properly. And it actually hasn't been shown to be very effective. We have other people that will start to use night guards or splints. And for some people, it may offer some relief. For many people, it actually can increase the problem and it can disturb the sleep where it's just too uncomfortable to have this thing in your mouth while you're trying to sleep. So that can get in the way because insomnia is one of the factors that will increase problems with TMJ. Now, then we know that there are people that will try to go to more drastic levels. And in the past, we used to think that it was misalignment of the teeth that caused TMJ problems. But now we know that that's not actually the cause. And yet we still have people that are trying to deal with it and they will get occlusional therapy or treatments where they actually are changing the alignment of the teeth. And again, that has been shown to possibly even worsen it. And there's no studies that show that it actually is effective. And then people may go to the drastic nature of surgery, where they actually are going in and having surgery done. And again, this would be a last resort if you have degenerative changes in your jaw or if you've had trauma that has broken your jaw, then okay, surgery may make sense, but as a last approach because again, you can't go back from it. So these are the conventional ways that things are dealt with. I'd like to go over with you in future videos what are the ways that I work with people right here in my clinic where we get great results of addressing these TMJ problems. So stick with me here on the next video and we're going to start to go into those pieces as well. We'll see you soon.